Hello and welcome again to the first strategy, Know the NCLEX-RN exam. In the previous section, we discussed how you apply and registered for the examination. So in this section, we'll discuss the test plan set by NCSBN for the NCLEX-RN exam for 2019 to 2022. The test plan contains in-depth information regarding exam content, exam administration, and item writing exercises. So let's begin. So what can you expect for your examination? You can find lots of important information on the test plan created by NCSBN. You can download the test plan in the resource folder I have provided there. The test plan of NCLEX-RN is effective April 1, 2019 through March 31, 2022. The test plan is reviewed and approved by the NCLEX Examination Committee every 3 years. So in this discussion, I have summarized important concepts and information for you to know and be aware of. The framework of client needs was selected for the examination because it provides universal structure for defining entry-level nursing actions and competencies and focuses on clients in all settings. The content of the NCLEX-RN test plan is organized into 4 major client needs categories. 2 of the 4 major categories are divided into subcategories. The category and the subcategories are shown in the graph. Safe and effective care environment is the first category, followed by health promotion and maintenance. The next is psychosocial integrity, and last is the physiological integrity with 4 subcategories. There are sample questions that I will provide later on with these categories and subcategories. Feel free to pause the video later to learn more about them. But now, let's take a look on the first category and its subcategory. The first category is the safe and effective care environment. In here, you as a nurse promotes achievement of client outcomes by providing and directing nursing care that enhances the care delivery setting in order to protect clients and healthcare personnel. The first subcategory is the management of care. In here, you as a nurse should provide and direct nursing care that enhances the care delivery setting to protect the patient or the client and the healthcare personnel or your colleagues. Related content in this subcategory includes, but are not limited to, of course, you need to initiate, evaluate, and update client plan of care, and at the same time, provide education to clients and staff about client rights and responsibilities. There is also an example that is provided here, and you can see that in this example, this question addresses the subcategory management of care in the client needs category, safe and effective care environment. Note the strategic word that is highlighted here first. So you need to establish priorities by comparing the needs of each client and deciding which need is urgent. You can pause this video to learn more about this question in this subcategory. Otherwise, let's move on to the next subcategory. This is the last subcategory under the safe and effective care environment, the safety and infection control. You as a nurse should protect clients and healthcare personnel from health and environmental hazards. Some of the key activities in this area are to ensure proper identification of client when providing care, verify appropriateness and accuracy of treatment order, and apply principles of infection control such as hand hygiene, aseptic technique, isolation, sterile technique, and the universal standard precautions. And here's an example of an exam question related to this subcategory. Pause this part of the video to learn more. The next category is the health promotion and maintenance. You should provide and direct nursing care of the client that incorporates knowledge of expected growth and development, prevention and early detection of health problems, and strategies to achieve optimal health. Key activities involved here is to assess and educate clients about health risk based on family population and community characteristics, assess clients' readiness to learn, learning preferences and barriers to learning, and plan in or participate in community health education. Here's another example for this category. For the psychosocial integrity category, you should provide and direct nursing care that promotes and supports the emotional, mental, and social well-being of the client experiencing stressful events, as well as clients with acute or chronic mental illness. Key activities such as assess client's ability to cope with life changes and provide support, assess the potential for violence and use of safety precautions, and incorporate client cultural practices and beliefs when planning and providing care. The question addresses the client needs category, psychosocial integrity, and the content addresses coping mechanism. Kindly note here the select all that apply questions. You can pause this video to learn more. The last in the category is the physiological integrity. Here, you need to promote physical health and wellness by providing care and comfort, reducing client risk potential, and managing health alterations. The basic care and comfort is a subcategory under this category. You should provide comfort and assistance in the performance of activities of daily living. Activities that are included in this are the following: apply and maintain or remove orthopedic devices, implement measures to promote circulation such as activity or passive range of motion, positioning, and mobilization. This type of question addresses the subcategory basic care and comfort in the client needs category physiological integrity. And this question addresses client's nutritional needs related to medical condition of the client. The next subcategory is the pharmacological and parenteral therapies. You as a nurse should provide care related to the administration of medications and parenteral therapies. Key activities here involve prepare and administer medications using rights of medication administration. You also need to review pertinent data prior to medication administrations such as contraindications, lab results, allergies, and potential interactions, and lastly, participate in medication reconciliation processes. And this is an example of a pharmacological and parenteral therapy question. Feel free to pause this video to learn more. The next subcategory is the reduction of risk potential. As a nurse, you should reduce the likelihood that clients or patient will develop complications or health-related problems related to existing conditions, treatments, or procedures. Sample key questions are: assess and respond to changes and or trends in the client vital signs, perform diagnostic testing such as electrocardiogram, oxygen saturation monitoring, and glucose monitoring, and of course, monitor the results of diagnostic testing and intervene as needed. This type of question addresses the subcategory reduction of risk potential in the client needs category, physiological integrity, and the nurse's responsibility in preparing for the client for diagnostic examination. Feel free to pause this video again to learn more. For the last subcategory, physiological adaptation, you as a nurse should manage and provide care for clients with acute, chronic, or life-threatening physical health conditions. Example of key activities are: monitor and care for clients on a ventilator, monitor and maintain devices and equipment used for drainage such as surgical wound drains, chest tube suctions, negative pressure wound therapy, and perform and manage care of clients receiving peritoneal dialysis. So this is an example of a question that addresses the subcategory physiological adaptation in the client needs category physiological integrity. This question addresses a health condition and its associated symptom. Review this question by pausing this video. So, the 2019 NCLEX-RN test plan required the nurse to apply the fundamental principles of clinical decision-making and critical thinking to the nursing practice. In addition, the following concepts are applied throughout the 4 major client needs categories and subcategories of the test plan. These are the nursing process, caring, communication and documentation, teaching and learning, and culture and spirituality. Therefore, the NCLEX-RN test plan provides us a concise summary of the content and scope of the examination. It serves as a guide for both your exam development and at the same time for you as candidate preparation.